Let me ask about health care in general. 1 million North Carolinians right now without health care coverage right now. It puts us 9th highest in the country. What do we do about that?
I think we need to go back. If you take a look at the Affordable Care Act, or what's referred to as Obamacare, it may have been well-intentioned, but it was horribly executed. We're no better off for that 20 or 30 million Americans, 1 million of them in North Carolina, who need access to affordable health care. Now, many people who have health care policies, they can't afford to use it. It's only there for catastrophic purposes. We need to figure out how we can expand our safety nets through Medicaid when it makes sense. But we also just need to create more opportunities for businesses to offer job-based health care so that people can get health care that they can afford.
If I heard you right, you said expand Medicaid where it makes sense. The state's obviously having that fight right now. Should the state expand Medicaid coverage here in North Carolina?
I think that, you know, they've got, when I came in as Speaker of the House, we had a $750 million shortfall on Medicaid. We had not implemented the program properly. It's vastly different today than it was when I came into the State House as Speaker in 2011. You've got to do it, but you've got to be able to pay for it, and you need to understand that it's not acceptable when you come up short because you don't manage the programs properly to just cut provider rates, cut doctors, cut the healthcare professionals' rates to pay for bad execution of Medicaid policy. You should always look at ways to provide a safety net for people who need it.
Or is that no on Medicaid expansion in North Carolina, only in certain cases?
I think it really, I mean, there's a number of things that we should look at when we're talking about Medicaid. Clearly, for people who can't afford it, who are ill, we have to provide some sort of a safety net. But you've got to look at the specific circumstances on the ground. So it's not a broad-based expansion. And in fact, over the past several years, many more people are on Medicaid today than they were in 2011. But it's done on a systematic basis, and it should be a path of last resort. It should not become just another health care program. It has to be something that we can pay for, and it provides care for folks who need it.